Mr. City Manager, the first item is the community health assessment. Is that correct?
That is correct, Mr. Mayor.
How would you like us to proceed,
We
sir?
will go ahead and bring the Director of Health, Christina Heinen, forward and get down to business.
Thank you, sir. And start at your pleasure.
Good evening, Mayor and members of the council. My name is Christina Heinen. I'm the Health and Animal Services Director for the City of Independence. Tonight, it is my pleasure to present to you the findings of the 2022 Community Health Assessment. The assessment was sent to approximately 10,000 households in October 2022, and we had approximately 1,000 responses. When conducting the assessment, we had three main goals: to gain a better understanding of the health issues our residents are facing, to collect the necessary data to apply for any grants that we may get the opportunity to apply for, and to evaluate the services that we currently provide by the department and any gaps we may have. Tonight, I want to share with you the top 5 public health issues as identified by our respondents and additional areas of concern as identified by our staff. This is not an exhaustive list by any means. If you've taken the opportunity to look through the community health assessment, you will see it is long, it has a lot of data, so I'm just gonna hit some of the highlights tonight. The top 5 public health concerns for our respondents were houselessness, affordable housing, gun violence, mental health, and drug use. We would also like to highlight the additional areas of socioeconomics, chronic disease, and COVID-19. The number one concern for our respondents was houselessness. Houselessness has been a growing concern across the nation and has been increasing over the past few years. In 2020, nationwide, there were approximately 580,000 people experiencing houselessness, with 70% of them being individuals and approximately 30% of them being individuals with families. People over the age of 24 make up 74% of those experiencing houselessness. Houselessness is connected to declines in physical and mental health and higher rates of drug and alcohol use, tuberculosis, and other infections. Affordable housing is also a rising concern for Independence residents. In a 6-year period, Independence saw a decrease in the number of units in multi-unit housing and an increase in the median mortgage for residents. In 2021, 33% of Independence residents paid more than 30% of their income on monthly housing costs, which is higher than the Missouri rate of only 25% of their residents paying more than 30%. These households are considered cost burdened by the Department of Housing and Urban Development. The third public health priority for our respondents was gun violence. As we know, gun violence and mental health are strongly linked. Nationwide, gun deaths are more likely to be self-inflicted than homicide. In Independence, that rate is more than double. In fact, in 2020, Independence had a much higher rate of suicide by firearm than that of Jackson County, Kansas City, or the state of Missouri. The fourth area of concern for our residents was mental health. Among Independence youth, 116 individuals under the age of 19 were hospitalized for self-inflicted injuries between the years of 2005 and 2015. 17 Independence youth under the age of 19 died as a result of those self-inflicted injuries. In addition to an increasing rate of suicide in Independence, Independence has a higher suicide rate than Eastern Jackson County, Kansas City, the state of Missouri, or the United States. Drug overdoses is the leading cause of death among adults age 18 to 44. In 2021, 1 out of every 47 deaths in Missouri was attributed to an opioid overdose. Over 70% of drug overdoses nationwide involve opioids, whether it's fentanyl, heroin, hydrocodone. It would be remiss for me to discuss public health and not discuss one of the major factors that contribute to health outcomes, socioeconomics. I'm sorry to report that in Independence, we are not as well off as the rest of the state, and we are doing worse than we were 5 years ago. Our family size is smaller, our income is lower, we have a higher unemployment rate, and we have more individuals below the poverty line.
Can I clarify just for a
Yes.
second? Is that worse? So repeat those stats again, then I want to ask a follow-up, if you would, please.
Yeah. It's our family size is smaller, our income is lower, we have higher unemployment rates and more individuals below poverty. And you'll see on the graph, we're comparing Independence to Missouri on average. And then we also compare the change from 2018 to our current. So we are decreasing or increasing as we go, but not in the ways we would like.
Okay, so if we ask about this, then the average family size was 3.1 5 years ago, or excuse me, in the state of Missouri, as of the last statistic you had, and in Independence it was 2.9. Has that changed?
For the state of Missouri, I don't have that data right in front of me. I know for the state of, for the city of Independence, that 2.9 is a decrease of 9.38%.
Okay, so basically a percentage point at that point. So it would have been 3 5 years ago, roughly, if we were around, and then 2.9 today. Okay, and then the per capita income went from 31 down to 28. Median
Well,
household income in
well,
the
it was
state, or excuse me,
31
that's
for-
from the state of Missouri.
Yeah.
Okay.
Yes.
And then state of Missouri is 61,000 compared to 52. Unemployment, civilian labor force, state of Missouri, 4.8 roughly. We were 5.9 when this data was collected. And when was,
So this is 2021 for a lot of these numbers,
okay, so it'd be like maybe December of 2021 roughly?
correct?
Okay. I'm not questioning them, I just want to try to understand them. So, and then individual below the poverty line, 2021. So we've got 16% of our individuals in the city of Independence that are below the poverty line compared to 12% in the state of Missouri.
Correct.
Okay. Do you have any policy thoughts on what you would recommend for us to do as a council in order to address those concerns? Or is that for another discussion? I want to give you a way out.
No, it's okay. So that is for another discussion, and that's one of the things I'm going to talk about at the end. A lot of this is gathering that data, seeing what we have. The next steps are working with those stakeholders, working with staff, coming up with ideas for how to address these things, and making a plan. Normally, community health improvement plans are 3 to 5 year plans, so making that plan going forward about how do we address all these things.
Okay, thank you. Please forgive the interruption, but I just
No,
wanted
you are
clarity,
fine.
'cause
I
that's-
am not an expert in
Those were stark, and I
economics,
was
so
surprised, and so that's why I just had to take a moment to,
we were surprised by them too, which is why I
Absorb.
wanted to highlight them.
no, thank you. Please proceed.
Can you, so on unemployed civilian labor force, you show it is plus 90%. So you're saying that our unemployment rate was below 3% for it to have gone up that much? That, I don't know that we've ever had an unemployment rate of 3%.
I can go back and double check all the numbers. I don't have the numbers right in front of me at this moment.
Okay, that seems unusual. Thank you.
Can I ask
Do you have
one
a
question?
question? Go ahead, please
Oh.
proceed.
So this, if I, and I'm not sure that I heard it correctly, but this data is through December 2021?
It is through 2021. There are some, like the per capita that you see that it's 2020, but most of these are American Census surveys that are back in 2021.
So we're about 12 months behind on this
Yes.
data? Okay. All right.
There's, the wonderful thing about the community health assessment is we're able to gather that primary data and get it quickly. Some data, there's a delay.
No, I understand.
Yeah.
I mean, I think we all know that things aren't the
Yes.
same 12 months ago, so, okay, thank you.
Independence also has a higher mortality rate when looking at chronic disease. As these graphs show, in 2020, the mortality rates for heart disease, stroke, and chronic lower respiratory diseases We're higher in independence than the state of Missouri, Eastern Jackson County, or Kansas City. Now for a bit of good news. In Independence, our 2020 rate of COVID-19 mortality was actually lower than that of Kansas City, Eastern Jackson County, or the state. However, it's important to bear in mind that 31% of our respondents reported that COVID negatively affected their mental health. Tonight, I've shared those major areas of concern that we've highlighted in the community health assessment. As I've stated, there are lots of data points in this community health assessment. It is long, we ask lots of questions, so this is just the tip of the iceberg. And it's also just the first step in the process. As I was explaining, next steps are community health improvement plans. It's working with staff, it's working with stakeholders, it's working with the council to come up with ideas and plans moving forward, identifying those gaps in our service areas, and determining ways forward. Any questions?
Any questions from anyone? I don't want to jump in first, but thank you. I'm pained by the numbers. I'm incredibly concerned by the numbers, and what do we do as a council is important. This may be a question for the city manager, if I may, because
Of course.
what have you seen other cities do when they have a community health situation like this? What is their response? How do they respond? Or do we want to actually go look and see what some of the best practices are and go from there? I mean, I'm literally opening it up for kind of almost discussion between the council and the two of you to see where we go and how do we proceed.
Yeah, it's a great question, Mayor. I think the first step's been accomplished, and that's a credit to Ms. Heinen, and that's conducting a new community health assessment. As she mentioned, it's been way overdue to have a current assessment conducted, and part of a way of solving a problem is understanding what it is and acknowledging there is a problem. So I think this does represent an important first step. I'd be happy to work with the director and her staff to put together some additional recommendations for the council, but I'll go ahead and steal a line from the presentation I plan to give here in a little bit and remind the council that a budget is a statement of priorities, and it is a statement of values, and it's really reflective of more than just lip service to these issues. So I think it's important as we move fiscal year to fiscal year that if this is among those higher priorities, and it would be my recommendation that it is, that we identify the places that are lower priorities and reallocate those resources toward those best practices and those programs and solutions that will allow us to get our arms and fingers around these community endemics.
Okay, thank you. Thank you. Any other questions from anyone? Please proceed.
Mayor?
Absolutely.
So there are a couple of things in here that fit very well with our master plan. One of those is the paucity of sidewalks. And I know that we have discussed, especially around schools, that there are not necessarily safe places for kids to walk and bike to school. And that fits in with our infrastructure opportunities. The other is that as Medicaid expansion has gone forward and the state is considering continuous eligibility for Medicaid coverage for children under the age of 18 who meet the economic criteria, that is an area that is absolutely fixable. I would hope that the health department will bring forward some partnership opportunities with our local schools, et cetera, because that one doesn't require our resources. Those resources are available. It really is just making sure that people are enrolled. That problem is going to get a lot worse as we do redetermination in the state, so we can expect that number to rise.
Yes.
So we need a plan up front, since children's mental health is the other thing that's come up so much in there, making sure that those resources are available for kids and young adults. So thank you very much.
Absolutely. Anyone else?
Yes, Mayor.
Please proceed.
Appreciate the work. I went through it today. It's a lot of information.
Yes.
One of the things that I was confused by is when we talked about on question one, my community, it didn't, it looked like you broke some of the things down, and I'm not saying you, I'm just saying it appears that it was broke down. Where like number 3 is gun violence, but I didn't see anything about crime. So I mean, and given the fact that we had a rough year with gun violence, I mean, I know that that was probably real fresh in people's mind, but I was thinking about all the calls that we get on just criminal activity. I don't think I've ever got a call on guns, maybe once, but criminal activity, just crime as a whole. Why did we not put that as a category that because that's, I mean, it is a big category, but I think it's a little more, it's something that we can address maybe better than gun violence.
So there's a couple of reasons. I can't give you the exact reason because I know we had this discussion months and months ago
Sure,
when we were trying to determine it. I know there were a lot of things that we discussed putting in that section and a lot of things that we had to cut. We had to cut a lot from the community health assessment that we wanted in order to make sure that it was short enough that we thought people would still complete it because it was quite the long assessment. So we did pick and choose what we had, when looking back at other community health assessments, how people had answered, what they had looked at, and trying to determine, looking at the model community health assessments from other areas, what Healthy People 2030 is looking at, some of those things, and trying to model it best in order to get the answers we needed. It's not a perfect document, it never is. We have things that we know we're gonna change for next time. So a lot of it was trying to determine what we thought people were going to need to answer and what we could address as a public health department versus a police department. So getting some of that. We know that people are concerned about crime. We also thought, well, you know, this is something that we've never asked about gun violence before. It's one of those things that we wanted to put on there and try to get to some of those harder questions and try to feel that out, especially with the big push for mental health. We knew that was going to be an issue, and we know how it ties with gun violence.
Oh, I agree. I just wonder if we would have had different results had we had that crime category and a gun
Yes.
violence category. If maybe gun violence wasn't on there, but crime was. I don't know, but I would like to, if there was a way that we could maybe, I don't even know that we can, the survey's done, but, and I think we are all aware that there's issues there. And then in the homelessness too, just in reading, there are, I like the information, but I think there's other issues within the homelessness issue, since it's number 1, if there's a way we can expand on that some more.
I'm sure there's a way, and
Yeah.
I've already put it to my staff
Yeah.
for little things that we want to tweak for next time, what we want to look for. Normally, a community health assessment is done every 2 to 3 years, so we're already gearing up with the thought of how do we ask these questions next time, what do we want to change? Do we want it to simply be a mailed and online survey? Do we want there to be a piece in person where we're meeting with people and discussing this? There's lots of things we want to change. So we will definitely add that in. I know that they're over there taking notes.
Okay, good. And then, Mr. Walker and I have had several discussions on the issues of food.
Yes,
For
food
our
insecurity,
community.
yes.
Food security's big, and I think that's something that we need to, I'm not asking for you or anyone else to come in, but it's a discussion that needs to be had. And I think part of the obesity issues that we're having is because of the food insecurities. And I'm not even sure that, you know, the diet of even when you took this, because you could still get value meals for $5-6. You can't touch them now for that. And so families were kind of reduced to, it was cheaper to go through the drive-through than it was to go to the grocery store. And now I don't even think it's cheap to drive through the drive-through.
We have had discussions with the city manager's office, and we'll continue having those discussions. There's multiple ideas we have about addressing food insecurity. We already have our local public health disparities initiative, which works on the grocery delivery subscription service in order to combat food deserts. But we are in total agreement. Food prices are high. Walkability is low in many areas. We know that there's issues that are contributing to obesity and cardiovascular diseases and all of those things that are lowering the health outcomes for our citizens. And we're trying everything we
I
can,
know.
throwing it against the wall to see what we can get.
And I'm not looking for answers tonight, but
Yeah.
I would like it to be a heightened awareness for discussions with all departments. How do we
Yes.
do this? I mean, I think we've got this farmer's market that we really need to emphasize, buying local produce.
Well, and they also have the Double Up Food Box. I will go ahead and give them their little pitch. Their Double Up Food Boxes for individuals who are on the SNAP program to double the amount of, fresh fruits and vegetables that they can purchase. And it's a phenomenal program, and we are extremely lucky to be part of it. Joe Antone, our market master, has been part of it from the very beginning. These are individuals who are deeply concerned about our city and making sure our residents have good health.
How do we get the word out on that?
Well, I mean, by me talking about it here, I know we've talked about it in the city scene. I know it's been discussed. They've done City 7 promotional videos about it. They've sent out flyers. I mean, we can try as many things as we can. Sometimes it seems like short of a door-to-door campaign, it's difficult to get that word out sometimes to those people.
Yeah, I mean, it's fantastic. I'm glad that we have that in place. And then the other thing about public transportation, we've had to cut back because of funding issues, and how we expand that, I don't know, because it's about affordability. But I think it is a huge concern. And I did drive by the Vale Mansion, Mr. Perkins, and saw some cool sidewalks there. Those would look really nice along Jones Road. So, and that bridge is fantastic too. So, I mean, the more we can do for sidewalks and getting clear paths, safer paths to the grocery stores and things like that, I think those are just things I think we have to talk about as a city. So, appreciate it. Anything else that we can look at here?
You tell me where you guys want to go, and we are happy to go. Our staff is enthusiastic about doing all of this. The public health work, they are happy, they're excited, they have tons of ideas, and they are going after grants as often as they can find them, and they're being very successful.
Well, the fact that we did so well through COVID is a testament to your hard work and efforts. I think
Thank you.
In a difficult time when nobody knew how to wade through these waters, you did a great job, and it shows in the numbers. So I commend you on that. That is good work. So, but the food thing, I would really like us to focus on. That's all I have, Mayor. Thank you.
So all not-for-profit hospitals and all health departments have to do these either on a 3 or 5 year rolling basis. So how are we partnering with Jackson County Health Department, because they also have to do
Yes.
a community health improvement plan? And people who live in Independence are fluid, and we have long borders with many other municipalities. So
When we were in the process of doing this, we were in conversations with Jackson County about not only data sharing, but once theirs is complete, anything where we match up and we want to pursue a similar improvement plan, we are on board for assisting. We have a good relationship with them, staff work and talk to them almost daily. We understand that this is a huge issue, and that only by working together, whether it's through Mid-America Regional Council and working as a region, whether it's working directly with Jackson County, we want to be there for those discussions, and we want to be there for those solutions.
fantastic. I'm lucky enough to be part of that work group, and they've done great work, so I'm delighted to hear that we'll be partnering with them.
Good.
Thank you.
Can I ask one other thing? Can that program, can we communicate somehow to the schools?
So the schools sit with us on multiple different work groups we have, and then we're fortunate enough that the Independent School District has a member on our Board of Health also, so we stay very involved and connected with them, and work with them whenever we get the chance.
Great. I just want to make sure that they're.
Sometimes I
maybe-
think they get a little bored with us, yeah, they're done with us asking so
That's
often to
okay.
partner, but yes.
That's okay. They can be bored with us.
Thank you. Thank you.
Next is the Capital Improvements Program. Is that correct, Mr. City
That's
Manager?
correct, Mr. Mayor, and our Deputy City Manager is here to give it.
And I love the fact that he was so excited to be ready to give it. He was going up there even before it was announced, and that was good work. That's
I
above
was
and
running.
beyond.
Yeah, I was running. All right, good evening. Yes, we're going to go through the 2023-24 proposed CIP. I'm going to move fast. Stop me along the way if you want to ask questions, all right? So our CIP is really the most important, one of our most important planning tools we have. It really defines how we invest in public infrastructure and equipment. Here's a look at our 6-year CIP. This is what's required by city charter to present and obtain approval from the Planning Commission. Over the next 6 years, you'll see that we're planning to invest over $250 million in the city in infrastructure.
For the people listening, CIP means,
Sorry about that. Capital Improvements Program. All right. Again, this is one of the most powerful tools we have as a municipal organization, and it directly impacts how residents and businesses experience our city, and it's a way that we best facilitate private capital investment and grow our economy. See, the CIP, or the Capital Improvements Program, takes a variety of different funding sources to make this happen for us. In the proposed CIP here, about 15% of the resources here are from grants or state and federal programs. They're leverage dollars for us. And this is really a direct reflection of the work our staff does to come up with creative ways to stretch the limited resources we have and invest in our community.
for clarification, you said what percentage are grant funded?
About 15%.
Thank you.
And that's, cost share programs, grants, all sorts of different dollars that are coming from outside the city that we're using. Okay, so again, this is our proposed capital program. The largest investment area is with municipal services. This is 43% of our CIP, nearly half. So this covers sewer, waste, stormwater, streets, bridges, sidewalks, you name it. Okay, we're investing $26.5 million in streets, bridges alone. For the fire department, this is not normal, but the fire department this next year and the coming years will represent 30% of our CIP. And this is a result of replacing stations 5 and 8, and then the additional station 11. This also covers the replacement of a pumper. IPL represents 16% of our CIP. The largest investment area is for the new substation, which is going to support the area surrounding the North Point project. And much of those expenses are contemplated to be reimbursed through the economic development tools that we have in place for that project. In water, 9% of our CIP. Yes, sir.
Could you go back to that slide? I just want to make a couple of quick notes on it. Yep, I've got it. Thank you. Apologize for the interruption.
So for water, 9% of our CIP is directed towards water. And the primary investment area is replacement of our water mains. And we're slowly growing that number. We need to be at replacing 1% of our water mains annually, and we're not quite halfway there right now. I'll get into that in the second part of this presentation. Police, really, they have one project, and that's a replacement of a mobile command center that they have. And this would be a more agile, functional piece of equipment that can navigate our roads a little bit better. And then Parks, Recreation, and Tourism is just 1% of our CIP. And this is to fund repairs at Bingham Wagner and Vale Museum and Vale Mansion. If we get a 50% cost match grant. So this would provide half the funding if that grant were to be approved. And then Santa Fe Trail Park replacement of their playground. So I just went through really quickly what we're doing, and there's the comprehensive document is in your agenda packet, but now I'm going to talk just a little bit about what we're not doing. And we excluded IPL from this exercise just because of what was recently authorized by the city council, and there'll be, I'm sure, a rigorous analysis of that area and investment. So street maintenance. Right now, bridges are a big concern for us. We have 3 bridges that are closed right now, and another 9 will be closed and that need to be replaced in the next 7 years if we don't do something about that. Pavement management program. This was an area that we've made great strides in over the last 2 years. We're able to touch every road in the city in about every 12 years, which is much shorter duration than what we used to have. And then curbing is an area that we have areas of the city where the concrete was really bad, and those curbs are deteriorating constantly. Water department, we have 766 miles of water mains in the city. Best practice is we replace 1% a year, so we need to be replacing about 1 mile a year. That requires $11.5 million a year to do that right now. And so right now we're budgeting $5 million a year. So we need to increase that by $6.5 million to fully replace our system. Facilities, our public facilities are one of our largest assets. Here's a list of all our facilities that are 50 years old or more, starting at the newest to the oldest. Some of these facilities probably would qualify to be on this next list, our historic sites. So we have $8.3 million worth of needs in our historic sites.
Do you need to
right
go
now.
back?
Yes, sir.
What is the Napa building, built in 1905?
Yeah, it's right across the street from City Hall. It's where some of our facilities, where the reserve parking is.
Okay.
You face that building in the reserve parking area. So that's our facilities shop.
Thank you.
Yeah. Our, again, our historic sites, excuse me, I've been having a cough lately. Yeah, 8.3 million worth of deferred needs here. Here's a list of our parks and rec assets, our amenities, all our playgrounds, athletic fields, and everything else. Requires nearly $44 million worth of investment. And this was identified in the Parks Master Plan a decade ago. Wastewater, our biggest risk here is the uncertainty of the regulatory world for us in the federal, state and federal level. And also the flat growth, or flat usage we experience, so there's no revenue growth here. So our CIP, what we're projecting is our current rate structure will not support our CIP over the next 5 years. Stormwater is what I call our kind of sleeping giant, because it sits there underground and deteriorates quietly. You don't know it's failed until you have generally till you have a hole appear. And for us, it seems to always appear in a roadway on a weekend. So it happens at the worst time for us. We have 85 miles of corrugated metal pipe in the city. To replace all that would require over $200 million. So that's a staggering number for me. So again, this kind of summarizes everything I just went through. We have a lot of investment needs. and deferred maintenance needs in the city, over $1 billion right now. And so our CIP of 92 million doesn't quite cut it. Do you all have any questions?
Proceed.
First, let me say thank you to the staff who is always looking for grants, always looking for matching funds, looking for opportunities to partner with state programs or federal programs, because there's just no way that we can handle the infrastructure needs. I think it underscores yet again the importance of us eventually issuing a general obligation bond to be able to chip away at some of these deferred costs. It's easy to hope the next council will deal with it, but those costs only continue to grow. So we just keep doing our best. Just two things I always want people to know. You've doubled the number of streets that you're working on. You filled twice as many potholes last year as you did the year before. And the staggering number for me is that we have almost 800 acres of public park and space that our Parks Department maintains. So just the sheer magnitude of what municipal services and your team has to deal with is really commendable and completely overwhelming to think about what needs to be done to get us there. So the best we can do is do every bit that we can and keep moving forward. So thank you.
Thank you. Anyone else?
Mayor.
Please proceed.
So the grand total of 2023-24 budget for capital improvements is $91,355,000 roughly. And we have funding to do all of that. Is that what you're telling us, or am I misunderstanding that?
That's in our proposed CIP, so part of the annual budget process. This would come forward as part of that.
I mean, because I'm looking specifically at the 28 million in from public safety, and when I was on public safety, I know it's changed, so because we have new funds, but when I was on public safety tax committee, there wasn't anything near that kind of money in a year that we had to work with. So, talk a little bit about that for me.
So for the facilities projects, we're probably overly ambitious in the CIP where we're going to be able to build 2 or 3 stations this year. We'll probably be able to undergo design and, go through a selection for whoever will help us build those this year. But that would include some kind of financing mechanism. In municipal services, back when it was Public Works, we issued debt through a lease program. We advance funded money to do some of our projects. And so there's different mechanisms short of a GO bond we can use to finance longer term debt. So that's more than likely those projects would need some kind of financing mechanism to put those in place.
So how much of that 91 million do we not have funds for then? I mean, would we need to obtain?
Sure. I'm going to come back with you with a definitive answer, but really it's probably just what you identified in the fire department.
Okay. All right.
The street sales tax and those other funds cover those projects.
Okay. Yeah, the other ones, they looked more in line with what I might have expected. That one kind of stuck out like a big red flag for me, so that's what I was. Okay, thank you.
Mr. Mayor.
Anyone else? Please proceed.
So, if my math is right, you've identified 136 projects over the next 6 years.
Okay?
Just go with me. Trust me, I'm just reading off of the
Sure. Yep.
boss's sheet here.
Yep.
So, at 286 million, that's roughly 48 million a year, doing 23 projects, if everything stayed equal. And how much do we have budgeted for each year?
In our CIP, Well, I can bring it back up here for you.
Because we saw one slide that was $1 billion.
Right.
Yeah.
So,
We're coming up short.
so our CIP right here, this shows, you know, we're much larger, of course, this year, and then it tapers back to around the 50 million mark going forward.
Okay. Okay, so I see how you categorize. I must have missed this slide. So leading up to this year, did we go back 6 years? From 22 back to 16, I mean, is that, are we doing 6-year?
We're required by charter to do 6-year CIP,
Right,
correct?
so how did, I guess what I'm asking is, how are we tracking? Are we able to get the 23 projects that you're done? Are these things that we can,
Sure.
We
So
can actually
but
do.
are we accomplishing what's in our CIP?
Yeah.
Some projects carry over,
yeah,
obviously. Some of these are maintenance placeholders. You know, they're, you know, for instance, in Power and Light, we probably have $400,000 programmed for emergent maintenance issues. If one of our CTs goes down, we have some funding to maintain that. So if that doesn't, we don't need those funds, then it rolls back into the following year.
yeah. Do we, and then my other question is, do we have CIPs, the projects that are more than 6 years old?
CIP projects that are more than 6 years old. There's probably some that are on our project list that we are pushing out now that may have lingered longer than they should have. I don't know the exact dates, but that's an area that we've been emphasizing probably over the last 3 years or so,
Right.
3 or 4 years. And that, you know, we're talking projects that require extensive planning, extensive site work. So getting those pushed through our system and out and in the ground, and catching up on that backlog does take some time.
What do you think our oldest project out there is right now?
I'm not even gonna try to venture a
You're not
guess.
gonna do? Okay. Well, thanks for playing. All right, that's all I got, thanks.
Anyone else? Please proceed.
Thank you, Mayor. So a big, Adam, big thank you to community development guys and gals down there, our engineer teams and municipal services. I mean, they're chasing grants and really working to pull some funds together to get a lot of these projects going. And it dovetails kind of nicely into our health assessment, because some of these sidewalks that we're going to be putting in will bring connectivity to the schools and bring them to the grocery stores. So a big thank you. One of the bigger projects that we have going on is the 24 Highway Complete Streets program, as you know, and that is going to be a massive reinvestment into the Northwest Independence that will bring some of that life and vitality back there. So talk about the lane miles. So the lane miles that we are paving, we're reducing that because of the cost of material has gone up, which reduces the lane miles that we can lay down. So can you explain to that a little bit, talk to that?
Sure. I mean, with oil prices, those fluctuate like any commodity does. And, you know, costs have gone up, so we're not able to, you know, mill and overlay as many lane miles as we used to. So we, you know, have really rethought our pavement management program and deployed other kind of intermediate maintenance solutions. A lot of other cities around us do this, right? And it stretches these dollars a little bit further, because not every street that is in bad condition needs a mill and overlay, you know, and that is not an efficient use of those resources, just mill and overlay everything. So there's intermediate solutions we can use that are cost effective, sometimes may not be the most popular, but they are effective, and they're within they are scoped within the resources that we have as a city and our network, street network that we have.
And I might add, the other benefit is when we were doing just overlays, on average, we were touching every street once every 25 years. The program that you and Mr. Norris are discussing is allowing us to touch every street in the city once every 11 years. So we've more than halved the amount of time before we come back around and touch your street within the city.
But with the city our size and age, and given where we have been and where we are at, it's almost time to grab that discussion and have that about a general obligation bond. One of those bridges that you've listed is in my district, Kentucky Avenue Bridge, and we have worked, your office has worked with my office, to work with the Kansas City office, with the Kansas City City Council, to no prevail. I just assume work with the railroad and try to go that route with different issues and work with Kansas City. It's been highly a disappointment, and we have the timelines to prove the disappointment there with working with them on that bridge. So the need is great, and I think is converging into a great point of having this bigger community discussion of a general obligation bond to put some of these bigger projects up for discussion. Our facilities, as much as people really like this city hall, it's antiquated, it doesn't work, it's not functional. Our police building is exactly the same way. There's a lot of room of improvement, but I'm pretty excited about where we're heading in the future here. So I think we have some good momentum going. So, but thank you to the staff for putting this together, because it's, what the heck is this thing? 80 pages?
Thank you. Anyone else? Yeah, excellent.
Okay,
Okay.
I just want to add
Please proceed.
one last thing. I'm sorry. You know, you've all talked a lot about connectivity, sidewalks, walkability. I want to highlight, we've been able to, over the last 12 months, look at our economic development projects and use that private development to reinvest in our infrastructure. The proposed project that is being discussed recently by this council, the Hub redevelopment project, there is $1 million plus in public infrastructure that's proposed to be invested as part of that project. Same with the North Point project. In this next year's CIP, there is $5 million worth of cost share dollars from MoDOT to improve Little Blue Parkway at I-70 and at Jackson Drive, and all through that corridor. Those are private sector dollars being reinvested in our community. So done properly, economic development projects can work to the city's advantage and achieve mutually satisfactory goals.
Perfect. Thank you. Great work, and thank you for all that you've done to get us up to date on this. Anyone else? Other questions? But thank you, Mr. Norris, and Mr. Walker, thank you. And the next item is the kind of the financial review or financial update, or how would you like to label this? Fiscal position update, I guess, is how we've labeled it.
That'll work, sir.
Very good. Please,
Okay.
please proceed.
I'll be happy to. Good evening, Mr. Mayor and members of the council. My name is Zach Walker, city manager. And as the mayor said, we're going to give you just a little bit more information tonight relative to the city budget. You may recall last month presented to you a picture of how our current fiscal year was wrapping up, a little bit of a general sense of where we saw next fiscal year going, but largely that presentation focused on our revenue side of our budget, talked a lot about our need to grow revenues in our city within our existing revenue streams, and also encourage the council to start exploring other revenue sources, like the conversation we just had about general obligation bonds, for example, to address $1 billion deferred capital maintenance backlog. Since that time, I've gotten quite a few questions from members of the council about the expenditure side of the budget. What are some of those issues in our budget that present some of the hurdles on an annual basis, those things that threaten our financial stability year to year? So we put some information together tonight that looks more at the expenditure side of the budget. Now, obviously, both sides of a budget have to be considered. We have to figure out ways to grow revenue, but these are also some of the known issues and challenges that on an annual basis have to be navigated around. And before I go through this, let me be very certain and very clear that I don't see any villains in this presentation. Everything we do in the city are things we've agreed to either through ordinance or contracts or things like that, but these are cost drivers in our budget that I share just with you for information purposes in your role as policymakers. So we'll go through some of these expenditures, talk about the implications those have in the budget, and then as a reminder, next month's study session will be where I formally present the submitted budget for the next fiscal year to the council. So begin here with this slide, and if you had your monocle on, you might see that this slide is telling you that just from a quick revenue perspective, there's still growth in the retail sales tax economy, which is a very important part of our budget. Largely, that number is still being driven by the inflationary economy, but there's growth happening in sales tax revenue, and it's been steady. We were able to update this information just this morning, actually, and we're sitting at about 5.3% growth through January compared to a 6% consumer price index, which what that tells us is we're closing that gap, which means our actual purchasing power is happening more naturally and not just as a result of inflation. So that's the sign of a healthy local economy, good things with our sales tax. This is the general fund balance forecast. No matter how many times we update the council with this, the picture does not change because the underlying assumptions are not changing. I've been told that sometimes I maybe come across as a little Pollyanna about the budget, so I'm going to make sure I'm very clear with you tonight. I do believe we are on the precipice of a financial crisis, and if we aren't getting very serious very soon about our budget, this picture is not going to become just a graph we show you, but a reality that we're dealing with here at the city in terms of bankruptcy, in terms of cutting basic services, in terms of eliminating positions, and other benefits and things associated with the city. This is something that is getting very serious. It has been serious, but we are running out of options of ways to mitigate these losses. We are running out of options about how to close that budget gap every year. I'll talk about that more in my presentation of the submitted budget next month, but this is a very serious issue, and time is of the essence if we are going to be able to still control our own destiny on this matter. Looking at the general fund by department, this gives you a sense of where our budget dollars are allocated. Over 78% of the general fund is allocated between the police and the fire departments, and mostly within that is allocated for personnel. 72% of those departments' budgets, police and fire budgets, go for personnel. So 78% of general fund is for police and fire. Of that, 72% goes to personnel. The primary expenditures or the preliminary expenditures, I should say, for the upcoming budget are $76 million. That is without any new budget packages. Department directors submitted about $1 million in new funding requests of items related to the council's action plan. That $76 million number is just indicative of to continue to pay for the things that we are doing today, also known as our base budget. Most of that growth that's happening in the budget is driven by salary growth. I will go ahead and tell you, because this is fixed in my mind and locked in, we are budgeting for a 3% market rate adjustment in salaries for our non-represented employees, and we are budgeting for all the other known wage increases in our collective bargaining agreements as well. By recommendation of the Staywell Committee, we also have budgeted a 10% premium increase in health insurance. So you can see those cost increases built in there, but the insurance is necessary to keep the fund solvent, and 3%, in my mind, is necessary to help our workforce keep up with what has been a very, very rough and aggressive inflationary economy. This is also the general fund, but just another look, less by department and more by expenditures. It includes the impacts of all of our recently negotiated labor contracts, our health insurance changes, our overtime changes, savings from vacant positions. This is kind of a real-time look at the general fund expenditures. Again, police and fire personnel are 80% of our total general fund headcount, okay? We have 578 employees in the general fund, and of that 578, 464 are police or fire personnel. 15% of our budget is tied up in operating expenses, 0.2% is allocated for debt, and 0.1% is allocated for equipment. The remaining 84.7% is allocated for personnel expenses, and by that I mean salaries, benefits, overtime, health insurance, etc. So with that background of where we're allocating money for departments and where we're allocating money in expenditures, I want to kind of talk about some of the big icebergs in the budget that we have to circumnavigate on an annual basis. I want to start with loggers, which is our retirement pension system. This is a statewide program created by the state of Missouri. There are municipalities across the state that participate in this retirement benefit plan. These projections that you are seeing here are actually provided to us directly by loggers. The categories on here, red is the fire department. We're real creative in the city manager's office. Blue is the police department, and green is all other employees. Loggers calls that general. That's not general fund. That's just everybody else who's not in the police system or the fire retirement system. The gray dashed line that is at the top above all of these is if you were to combine all of the 3 different pension retirement systems in the city, that's reflective of our costs. What I need you to know about this chart is no matter what decisions the council makes going forward, this chart is locked in. This is indicative of past decision-making about salaries, about benefits, about overtime. These are costs that we are going to have to bear. There are things we can do to bend the curve moving forward, but these lines on this chart are fixed. They aren't going anywhere. Every year, loggers can increase our contribution by no more than 1% of our payroll each year. But that said, you can see the sort of aggressive growth that's happening between now and when this begins to drop off after 2038, so about 15 more years. As I mentioned, we can do things to bend that curve, but we can't do things to change the bell that's been rung already. Some folks will ask me from time to time, well, what do you mean by different things that have driven those cost increases, the things that have happened in the past? So let's talk a little bit about what is driving that increase in loggers. One thing is headcount. Sure you're all familiar with the national conversation right now around Social Security. We have a similar issue here at the city. We have more people who have now retired than we have active employees paying into the system. That creates an imbalance, which is driving cost to the logger's contribution. Salaries are a part of that. Salaries have increased over time, as they do in any organization. So that's not necessarily a bad thing. That's a sign of a healthy organization that's trying to retain its employees, but it does have an impact on cost. Overtime. You may remember the presentation made by the special counsel, Dan Nelson, regarding the police department overtime last summer, and he used a term called pension padding, where employees will work more in their later years of their career to boost their final payout. I'll talk about that more in a minute, but overtime has an impact on loggers. And then other pays, what I'm specifically talking about there, in the fire department, there are things like minimum staffing, so the minimum number of people that have to be on a fire truck on duty, fire standby pay, or fire ordered in, if there's a circumstance or an event that requires more personnel to come in. So all of those costs, or all those issues, will fluctuate and drive your overtime. You can see on the chart, I just want to make sure I call out for folks, the dark blue is police, the orange is fire. Those are our two bigger overtimes, along with the yellow, which is Independence Power and Light. So I said I would talk a little bit more about this issue of pension padding, and I want to do that now. This is not a hypothetical chart. This is a real situation here at the city. This is a real employee in a real department, but we have sanitized it just to make this illustrative. But I do want to make clear that this is a very real example that I am giving you. If we had an employee that we'll call John Doe that worked their typical 40-hour work week, you'll recall that the benefit calculation for loggers is your average monthly salary times your years of service times your benefit multiplier. And the way that loggers works is that they will take your highest 3 years wages in your last 10 years of service, and that's how they calculate your average monthly salary. So if John in his last 3 years earned $239,000, that would make the average monthly salary about $6,600. At age 55, when John's thinking about retiring, he's now worked 25 years. The multiplier is 2%. That means that John's monthly logger's benefit was going to be about $3,300 a month, or over a 25-year period, a lifetime benefit of just short of $1 million, $996,000. But John has worked overtime. And John's overtime plus base pay now makes his 3 years of wages $591,000, which makes his average monthly salary $16,000, which makes his monthly benefit about 2.5 times what his benefit would have been, $8,200, or a lifetime maximum benefit of $2.4 million, closer to 2.5. You can see in the chart that we've broken out that John has worked an additional hours above what he typically did for overtime in years 20, 21, and 22. So the 2 years before, he worked about 200 hours of overtime, but in 20 he worked 860, in 21 he worked 2,200 hours, and in 2022 he worked 1,900 hours. These 3 years average represent 12% of John's total career, but have resulted in a 147% increase in John's projected lifetime benefit. I want to mention our retiree insurance program, not because we're talking about doing any changes with that, we're not, but because I want to make sure that you know that this is still a cost that we navigate on an annual basis. We have worked very hard with our retirees, Mr. Sorensen that's sitting to my left tonight, to come up with a solution that has helped limit this expense, the future growth in it. But this is still a program that, and this isn't pleasant to talk about, but our actuarials have told us will be a program we pay for through year 2070. Retiree health insurance total in our budget is $5.9 million, of which $3.5 million comes from the general fund. Total plan participants in that are 1,705 as of January 1, 22, not including eligible dependents, so just people who retired from. The total liability for that is approximately $180 million, or 300% of payroll. So again, it is a cost we know, it is a cost we budget for, but it is a cost we will live with for about another 47 years. Personnel is another major cost driver in any organization, and the same is true of the City of Independence. In our organization, 52% of our workforce is in the general fund, but 85% of our general fund budget goes for personnel. 84.5% roughly of our general fund personnel charges are for public safety, and 15.6% is all other departments. General fund personnel expenses do not include human resources, finance, and tech services, as those are located in an internal service fund. I'm not sure how these other cities are doing that, but I just want to make sure I was clear about that for our city. So you can see where personnel expenses in the general fund, 85%. These other three cities, 43, 67, and 65%. A large portion of that, of course, is our health insurance costs. Other cities aren't bearing that $3.5 million cost in retiree health insurance that our organization is bearing.
Mr. Walker,
Yes, ma'am.
can you clarify for me, other communities, we bear the health insurance cost for the retiree and their spouse until death.
Correct. And their eligible dependents.
Regardless of whether they are on Medicare, we have additional health costs that we are responsible for employees, and I know these were past council decisions. These are people who've served the city for 30-plus years, or help me understand who is eligible for that.
Today in our organization, we have three different classes when it comes to post-employment insurance. Up until 2016, up until 2016, anyone who came and worked for the city for 5 years became eligible for retiree health insurance for themselves, their spouse, and eligible dependents until death. In 2016, that changed to, I keep saying 2016, sorry, 2012. Please forgive me for that. Too many numbers bouncing in my head. 2012 was when that benefit changed. Prior to 2012, anyone who worked for 5 years for the city vested in that insurance benefit. Beginning in 2012, you had to work for the city for 20 years to vest in that benefit. So anybody hired after 2012 but before 2018, that 6-year gap, those employees have to work for 20 years to earn that benefit.
And then employees hired after that, we don't have that go forward.
Starting in 2018, we've changed that program to where all new hires are not eligible to accrue that benefit at retirement.
And say I start working for the city back in this previous period at age 20, and at age 40, I've got my 20-year service requirement in, and I retire at age 40 and go take another job, my other job has to pay my insurance at that point, or does the city have to carry me on someone, even though I work for someone else?
You would make a decision as an employee. You know, we've had, particularly in the public safety ranks, people that leave to take leadership positions in other organizations. They choose whether or not they want to join that organization's insurance or whether they want to stay on our insurance as a retirement because they have now officially retired from service with the City of Independence.
So the city could require them, if they have another option for insurance, that they take that option instead of the city insurance.
It would
Is that-
require a policy change, but
Okay. Thank you for that clarification.
you are welcome. Public safety is also a big part of every municipality's budget. We are not unique in that regard. But there are some interesting statistics specifically with our public safety. This chart compares public safety expenditures per capita, which means per resident, okay? So in the City of Independence, per resident, we spend, every resident, another way to say that, every resident is contributing $335.86 towards police. You can see that the average of those other cities is $243 per resident, the next closest being Lee Summit at $254. You see there, we also, with the exception of Overland Park, have more FTEs, but Overland Park with 369 FTEs is about $100 per resident less on police service than we are. And you can see Overland Park's about 70,000 more people than the City of Independence. On the fire side, per capita or per resident, Independence is spending $250, the average being $188. Again, we're second to Overland Park in terms of our number of FTEs. The interesting thing, at least to me, is that Overland Park and Lee Summit both have ambulatory EMS service in their fire departments, but both of those charging less per capita for fire service than is the City of Independence. This is a chart you've seen before. This is talking about transit. This is another real crisis that's staring us in the face. This is the last year of federal funds through COVID relief dollars that are helping us cover the subsidy needed to operate this program. After this year, after the budget that gets approved this year and goes into effect in July, we are going to have to decide if and how we fund this program moving forward. It's a real challenge. This service is used by about 10% of our residents, but one could probably argue that these are the most vulnerable 10% that are relying on that to connect to the outside world for employment, goods and services, medical care, et cetera. We are looking at what other cities are doing to address transit services in their community. We are talking with the KCATA about this funding challenge, but as I've mentioned before, this is about $1 million subsidy in the years when we don't have the federal COVID relief dollars helping to close that gap, and the safety net evaporates after this year. So that ends my good news presentation. There really is no solution just by itself, a standalone solution. It has to be a matter of increasing revenues in the city, but it also has to be a matter of figuring out how to contain expenditure growth and balancing that ratio of revenue to expenditures in our city. I believe that, as I've said before, simply cutting programs is not the answer. We are moving toward a priority-based budgeting model in the city where we will work with the council through your action plan to identify what your priorities are and allocate those funds in accordance with your priorities. This goes to what the mayor was asking about during the health survey conversation. We've talked about some of those big pressures. These are things that plague us every single year. And we've got the added challenge of many of those CDBG, COVID relief dollars evaporating after this year. So we will need to stare this down. That is why I use the term financial crisis staring us in the face, because a lot of those safety nets evaporate after this year. But we will work with you thoughtfully and carefully to make sure we meet the needs of this community. So, Mr. Mayor, with that, I'll conclude my presentation and take any answers or questions. If you've got answers, I'll take those too.
Thank you. Anyone have any questions? Please proceed.
Can you go back to the slide of public safety cost per capita? So I'll look at fire here just so that make sure I understand. Compared to Overland Park, our citizens are paying an extra $100 per person for their fire, but with fewer employees. And the causes of that, some of those are the pension padding, overtime stacking in those final years. Do you think those are some of the contributing factors?
They are, you're correct.
And are we considering any kind of policy approach to keep us solvent?
I know the council earlier this year adopted a resolution directing my office when we enter collective bargaining agreement negotiations to address FLSA, which stands for Fair Labor Standards Act, to ensure that our policies are in line with the FLSA federal law. So yes, we are, I would say more than considering, we have a mandate from this council to address that in the collective bargaining process.
Thank you.
Anyone else? Anyone else? Please proceed.
City Manager, you talked about at the beginning of your presentation about being in control of our own destiny. I guess my question becomes is, I know that you will be presenting next month the budget. I'm hoping, I don't know if your budget will take into account some and provide us with some alternatives or options relative to be able to control our own destiny. But I guess I would just tell you that I'm hopeful that they are, that it will, and that it will be able to provide us some options for at least consideration, so that we can address some of this now, as opposed to waiting until 2025. I think it was, when we fall off the cliff and go below. And go below zero. So I hope that, I guess that's just a statement, not a question, I guess, so to speak. But what can we do to decrease overtime, in the scenarios like what you showed us there at this stage of the process? Are there things that we can do to make changes now, or do we have to wait till bargaining agreements come up? Are there other things we could do now? I'm just curious.
I want to make sure the community remembers the council did adopt an amendment to the personnel policies for this city that all non-represented employees are now covered by and in line with the Fair Labor Standard Act. So that wasn't inconsequential. That was an important step the council took. The other 70% of our employees that are covered by a collective bargaining agreement, that will have to be done at the time of those negotiations. So as those come open, we will take the mandate that the council gave us in that resolution and work to effectuate that change at that time.
Okay. So essentially what I hear you saying is there's nothing we can do now. We've got to wait until, the opportunity comes up. So.
When I said these are icebergs we have to navigate, some of these are things that remain outside our control to address until such time as the opportunity presents itself.
Okay. You talked. I think you answered my other questions.
Very good.
Anyone else?
Mr. Mayor,
Please proceed.
couple things. Just keep in mind that the first order of government is safety and welfare of those people. So I know that we look at this and I see numbers, but I also realize that our first responders work really hard compared to some of these, and I know you know this. We have more calls in police and fire. We do have a hardworking department. So one of the things that concerns me is, and you and I have talked about this, and by the way, I'm really glad that you got that crystal ball all tuned up over the last 3 years.
Was that doom and gloom enough for you?
It was, you know, I feel like you were really seeing it clear this year, so that's good. I was wondering though, if you look at all the comparable cities, and the budgeting the way they do, in internal services, is it the same? Is it apples to apples or apples to oranges?
We have looked to make that apples and oranges by redacting some of those internal service charges in here. So this is reflective of salary and benefits. Now, it can't truly be apples and oranges because there are benefits that exist in those cities that don't exist over here, which is part of the cost driver that you see reflected in this table.
Sure, and I just, a lot of our overtime, we suffered through because we just didn't have proper staffing in public safety. We were running pretty lean. I get that. So,
I would agree with that in the police department,
Yeah.
yes.
and so, my reservation is when we look at where we are with our pay, I don't want to make us an unattractive city for recruiting. I think, you know, we've got to be edgy with both in police and fire, since we're seeing such a decrease in applications. We have to figure this out without hurting ourselves in our compensation. So I really don't want bargain basement cops running around, or bargain basement fire, and I know nobody does, you know what I mean? So I know we pay a lot, I see that. It's a tough balance. I'm glad you have your job, and we sit on this side and look at it, but I want people to realize that what we spend, I think it's a lot, but I think when they see what our teams do, it's money well spent to keep our city safe. And I'm not saying that because of those guys in the back, but they do a great job. And but I don't want to put ourselves in a situation, and I don't know what the answer is, Mr. Walker, I really don't, but I don't want us to jeopardize our ability to recruit the best, maintain the best, and keep the best on our streets and in our stations to protect our city, so.
Yeah, I guess you know, you and I, like you said, had a lot of chance to visit council member, and as I said at the beginning, there are no villains in this story.
Right.
Everything the city is doing is things the city has agreed to do, and you know, folks are just showing up for work. The I guess thing that keeps me up at night is the conversation you had a minute ago about, like, for example, food insecurity.
Right.
And trying to balance this value against that value, and trying to figure out where do we have enough of one thing without sacrificing too little of the other. And as you say, it's no easy math problem, but it's a conversation I'm confident we've got the right people in the room to answer.
Well, that helps me. I don't have to tell you part B of what I was going to say, because you just answered that. Because that's really our focus, is we've got to figure out how we maintain this and then start looking at this.
Yeah.
And there's going to be some tough decisions that are going to have to be made, that we're going to have to be supportive of, and I trust that you'll figure some of that out. But I don't want it to sound like I'm trying to make villains.
Oh, I know
If
you're
people
not.
just look at numbers,
Sure.
they lose sight of what we do
Mhm.
and how we do it
Mhm.
and why we do it.
There you go.
And so I just want to keep it in perspective.
There you go.
That these are people that actually go out every night and every day to
Yep.
do a very dangerous job
Indeed.
for us. So that's all. Thank you.
Bet.
Anyone else?
Mr. Mayor,
Please proceed.
you know, Mr. Walker, I was particularly proud of Mr. Fears and yourself, Mr. Sorensen, Mr. Veet, Ms. Gray, Cindy Gray, or not Cindy Gray, pardon me. Who's the other?
Culp?
Cindy Culp, thank you. You know, that served on that small group that came together and really helped out the Stay Well Fund. You know, that was a really, really good example of some folks putting their heads together and working as a team to the benefit of all. And I feel like there's some room for that kind of teamwork somewhere in here. You know, the council's found some of that too amongst ourselves lately.
I believe that the action plan this council unanimously adopted gives us a roadmap of council priorities. Our finance team has hired some incredible budget minds. Melissa's here again this evening, Cindy Gray's over there, who are moving this organization into an incredible place with this priority-based budgeting. It's going to allow us to have that conversation with each of you about those collective priorities and figuring out, as I said, the right amount for the right things, and right being, determined by those who are elected to determine right. So I wholeheartedly agree with you that we've got roadmap to get that thing done.
I appreciate that. I appreciate all the hard work you and your staff have done on this. I didn't mention this when Mr. Norris was up here, but I can't imagine what it must be like at your level, even on down to the guys digging ditches every day. When you look at the sort of insurmountable problem of all the ditches that need to be dug, and knowing that you're never getting all of them dug, that just must be rough. So it sure means a lot from where I sit that you show up every day and just keep digging.
I know it'll mean a lot to our staff, to the council's expression of that, and I'll make sure it gets passed along as well.
No,
Thank
very
you.
much so. It really does mean a lot, because, it's hard enough for us to sit up here and think, well, how are we going to fix this sliding off a cliff issue? Because we know some of the big picture things that are coming up, but, every day you got to show up and figure out a way to solve these things, and meanwhile also approve things that cost money to also move the city forward. So quite the balancing act, and I, for one, sure appreciate it. So thank you.
We've got creative people here, we've got creative people working out on the front lines, and we've got creative people that retired and just keep showing up. I will be watching Price is Right when I'm Bob's age, but he's still here helping us figure out, so.
Well,
Anyone else other comments?
thank
Please
you,
proceed.
Mr. Walker.
Please proceed.
Thank you, Mayor. Thank you for the sense of urgency with your discussion with us tonight, because there's a convergence of where we are at in a community and with our budgets, with our capital improvement needs, and also with our budgetary constraints. So it's one hell of a balancing act. Transportation. How have those conversations been going with the KCATA, given their leadership transition?
Fortunately, a lot of the leadership transition happened at the top. A lot of the middle management and rank and file are still the same individuals. So some of our community development director, Tom Scannell, who oversights the transit contract, has established good working relationships with a lot of those folks. And the individuals in those leadership positions now, fortunately, they weren't strangers to us. They're folks from the region that we've crossed paths with in other places. So the ATA is responsible for a lot of transit across the metro, and we're but one agency that's clamoring for those funds. But I'm optimistic. I'm optimistic right now that that's they've been there for us in the past, and I think we can get there again with this go around.
You said it best. It's the folks that are the most vulnerable that ride that for the most part. And then we redid our UDO ordinance about our group living facilities, which one of the requirements is to be within a half mile of a bus stop or different transportation locations. So if we start reducing that, then we're going to have to start rethinking how we change some of our internal policy decisions and making. And I would encourage, and I think last time we had to do almost a full court press with reaching out to the board of directors of the KCAT and give them our cause and give them some, ask for their decision-making and some direction for here, so.
Yeah, you're right, Councilmember. We were actually at a place where the budget picture was so severe that we, in that year, had proposed fully eliminating that contract, and that's when we put the full court press to the ATA and their board of directors, and additional supplemental funding came forward. So we certainly don't want to see it get up against the 11th hour like that again.
Well, we'll definitely keep the conversation going, but if you
Exactly.
see red flags popping up, let us know sooner than later.
Yeah, we will for sure.
Thanks.
Anyone else? But I do want to, you want to, go
I
ahead.
was just going to say, reminder, spend your money in independence. We
Please.
live and die by our sales tax. So when you go buy your car in Kansas or your washer and dryer in Lee's Summit, that has implications for the general fund. Thank you.
Thank you.
No, excellent point. I agree completely, and I just want to say thank you to all the men and women who work for the City of Independence. I, too, was an employee of the City of Independence, my first job out of college. Some of you may not know that, and so you do a great job, and I really appreciate it, and I know it's challenging at times, so, but thank you. Anyone else before we move on? Mr. City Manager, thank you, and I think we have some reports, if I'm correct.
That is correct. So we have a few boards and commissions that we're looking to make appointments. These boards and commissions, the resolutions are already on the agenda for the 417 agenda. So if we need to remove those, then I'll need to get that direction from council. The first is the Tourism Commission. They're wanting to appoint Scott Forsyth and Amy Kistler. If there's no objections, again, this resolution's on the 417 agenda.
Please proceed.
Board of Ethics, Andrew Rodriguez and Philip Glorosio. This is on the 417 agenda if there's no objections. All right, Stormwater Control Oversight Committee, Colleen Huff and Mary Smead. Again, this is on the 417 agenda.
Okay.
The Industrial Development Authority, appointing Pat Campbell. If there's no objections, this is on the agenda for 417. Planning Commission, reappointing Virginia Ferguson. If there's no objections, this is on the agenda for 417. And Parks Rec and the Parks Commission is Cody Stager. This is on the agenda for 417. And then we also have TIF Commission. It's not on the board report, but Councilmember McCandless would like to appoint Jim Conley as her individual appointment. If there's no objections, that would actually be on the agenda for May 1st. Okay. And then we have a few councilmember appointments. The Independence Economic Development Partnership Advisory Board, Councilmembers Fears and McCandless were both interested in serving. There's a resolution to appoint them on the 417 agenda if there's no objections. And then as a reminder, the Employee Advisory Committee, the terms are expiring on that. Currently, Councilmembers Hobart, Steinmeier, and Stewart are serving, but if anyone would like to serve on that commission, if you just let me know, then we can add that to another board report in the future. And then finally, we have 3 committees at the bottom of the board report. The first is the Brand Independence Committee. If there's no objections from the council, and we've talked with staff, this committee hasn't met for about a year now. There's a lot of expired terms on that committee. If there's no further business for that committee, the recommendation would be to disband that committee, and we'd put that on the agenda for May 1st.
Any questions or objections? Okay.
Okay, and then next is the Jackson County Animal Welfare Committee. My understanding of this is that the county will no longer be putting up individuals to serve in their positions, so the recommendation from staff is to combine the 2 individuals that are city appointments with the Health Commission, the Advisory Board of Health. So, any discussion on that?
When is that going to be on the agenda?
We could get it on the agenda as soon as May 1st, unless you would like more time.
Yeah, I'd like to have some more time to talk about it. There's some questions there, so, okay. Anyone else? Anything else?
And then one more commission. So Human Relations Commission, they've been having some issues with getting quorums with their current number of membership. They've had some individuals that have fallen off due to attendance and not meeting the requirements, so they do have several vacancies right now. And it's the recommendation of staff that we reduce the number of membership on this commission down to 9. Again, this would take into account to the vacancies that they currently have. So no one would be necessarily be getting removed from the board. The positions are already open. So that would be for discussion. And if you guys are okay with that, then we can get something on the May 1st agenda for that as well.
How many sit on it right now?
Oh, I think it's 13.
Thank you.
How many are open on there, Ms. Behrens?
I think they have 10 filled right now, but Andrew Rodriguez, who's getting appointed to the Ethics Commission, he also serves, but he would be resigning from that, which would get them down to their 9.
Great idea.
That's all I have. Thank you.
Thank you. Anything else, Mr. City Manager? Anybody else?
Mr.
Please
Mr. Mayor,
proceed.
Under discussions and topics, Mr. City Manager, after last Monday's meeting, we had an article on what took place regarding IPL. One of the things that was printed and has been circulated is that the earliest we would have anything going towards a ballot or for consideration will be November of this year. And that troubled me. I don't know how we're going to have such a wide topic and lots of discussion and a couple of studies done by November and have public meetings by November of 2023. I want you to know my desire, and I'm not speaking for anybody else on the council, it's my desire that we do this right. Not fast, we do it right. And I hope that we can get the same commitment from my colleagues that speed is not what we're after. We want the information done correctly, and we want this to be done in its time.
It's too important of an issue, I would say, to bring a rushed product. So we won't, as staff, bring something to you until we know we've worked through it thoughtfully and have something the community can use to make the informed decision, given the weight of the issue. I'm very certain of that.
I appreciate your thoughts on that as well, and any of my colleagues want to reach out to you as well to voice their concern or support. I welcome them to do that. So thank you. Thank you, Mayor.
Anyone else? Thank you. Anyone else? With that, we'll call the meeting adjourned. Thank you.